Hi, this is Dr. Renee Watts, and our patient question of this week is, what can I do to help my dry mouth symptoms? So we had a patient come in this past week who had been prescribed high blood pressure medication since her last dental visit. And while she certainly needed to be on this to help reduce her risk of heart attack, heart disease, and strokes, she found that as a side effect of the medication, her mouth had become drier. And we see this pretty often. Dry mouth is actually a fairly serious condition for our mouths. Saliva is important to the health of our mouths in that it helps lubricate our tissues during eating and speaking. Saliva also has antibodies and other antibacterial compounds that help reduce our risk of decay and mouth infections. And so when people don't have enough, it definitely increases their risk of decay and cavities. So first things to know once people realize that they're suffering from dry mouth are to start consciously avoiding things that are going to make it worse. So things like fruit juices, sports and energy drinks that contain high levels of sugars and acid and caffeine. Obviously sodas fall into that category, are things to start avoiding. Also avoiding sticky foods, because things that stick to your teeth if you don't have enough saliva are going to be hard to clear from your mouth, as well as avoiding sucking on candies and mints that contain sugar are also going to be important. Now, as far as what to do, obviously staying hydrated with just enough water is going to be important. People should also take care not to overhydrate their mouth and dilute what little saliva they may have. Now, if people get a little bored with plain water, they could certainly take some xylitol, which is a sugar substitute that you can find in most grocery stores or health and natural food stores. You can find it online. And adding a little bit of xylitol to either your water bottle or some brewed tea or coffee that you may make at home is going to be helping get something beneficial on your teeth. Now, there are a number of companies that also make products nowadays for dry mouth sufferers, and as far as what you may like, it can take a little trial and error. Also ask your dental team for suggestions they may have. I'll show you a couple of examples here today. This first product is a mouth spray, and so this is something that people just spray a couple times a day. That can be helpful if they're already getting enough water and staying hydrated. This particular brand has a high pH, so it's helping neutralize the acidic environment that people may have in their mouth. It also contains xylitol, which I mentioned earlier. So there are a number of other brands available. That's one. This line of products called Biotene you can find in many drugstores as well, or in the oral care department of any store. The Biotene brand is formulated for dry mouth sufferers. They're alcohol free. You also want to make sure that you are using some type of fluoride in some of your products as well. The toothpaste contains this, and that will additionally help decrease your risk of cavities. And then I have an example here of some mints that contain xylitol. And again, these can help reduce people's risk of decay while keeping their mouth kind of moist and hydrated. So these are just a few examples. As always, when people have a dry mouth and are at increased risk of decay, they want to make sure, of course, to be brushing, flossing, doing all those kinds of home care things, as well as getting in for regular dental exams, checkups, images of your teeth, so that anything that might come up can be caught and treated early in the game. So if you have any questions, please feel free to call or click any of the links below, and thanks for watching.